or prolotherapy. The treatments that are available to professional athletes are now available for you. Watch the videos at jointrehab.com or call the Darrow Wellness Institute at 800-300-9300. 800-300-9300. That's 800-300-9300.
Welcome back to Living Pain-Free with Dr. Marc Darrow. I'm your host, Nita Valens. We're taking your calls right here, right now. 866-870-5752 here in the studio. Lines are open for you to talk with Dr. Darrow. And we have calls coming in. Did you want to finish what you were saying or go to Timothy?
What was I saying?
I think we're going to Timothy after all in Los Angeles.
No, I'm teasing. Of course, I have a good memory.
I know you do.
Nita? No, I was talking about the husband's knees. That was a question that came in. But if you would like me to go to Timothy, and I know he would like it, sure. I'd be happy to. So, Timothy, I was just, this is Dr. Marc Darrow, by the way. I just want to give a little intro here. The show is about musculoskeletal pain, and you have pain in your left shoulder, which I will talk all about. The last question, which I didn't get to finish, was about knee pain. And so many people have knee pain, and, they say that they've had an MRI, they've been to orthopedic surgeons, they have to get surgery, or they've had a surgery that failed. And we get a lot of luck with knees. I'm not going to really call it luck, but we do very well. And I think we get more knees than any other part of the body. And I think next is shoulders. So it doesn't really matter to me if a person has a certain diagnosis. Let's say your shoulder has a rotator cuff tear, something of that nature. That doesn't impress me personally, because when you use regenerative medicine, whether you have a tear in your shoulder or a tear in your meniscus or something of that nature, that in and of itself doesn't stop the healing from taking place. And people come in sometimes and they go, I've got a rotator cuff tear, I want it to heal. Now what they're really saying in most cases is, I don't want to have pain anymore, and I want full range of motion. I want to be active. Once in a blue moon, we get someone who says, yes, I'm in pain, my shoulder hurts, and I have a rotator cuff tear, and I want it fixed. And I go, what if I can give you full range of motion, no pain, and you'll still have a tear? And they get kind of confused by that, and they go, no, I want the tear fixed. And then they go get a surgery and have that tear tied up, and it's, quote, fixed. And then guess what? They come back to me and go, the tear is fixed, but I have worse pain now than I had before. So we have to be careful that we're not necessarily treating a diagnosis. Instead, we are treating a pain generator, the area where the pain is being caused. So I wanted to start that off like a little preamble before I asked you about your own shoulder, just as sort of a setup so you can kind of understand where I'm at, and hopefully that'll help you cross the line from traditional medicine to a medicine that is more effective. I'm not putting down traditional medicine, but it is related mostly in the musculoskeletal system to using drugs and using knives. And I don't do either of those. I use needles to inject cells from the body, PRP or stem cells, to heal the area that is causing your pain. And one last thing that I'm going to let you talk, Timothy, is when we get an MRI that shows a tear, now this is on people that have no pain at all. We do experiments. We take people that have zero pain in their shoulders, their knees, their hips, whatever, and then we do an MRI for an experiment, and these are people that have no pain, okay? Guess what we find on the MRI? They have all kinds of tears. My story really is perfect for this because I had a shoulder surgery when I was in medical school. It failed miserably. It made me worse. I had a fever. My shoulder was worse before the surgery than afterwards. Later, I injected my shoulder, and it got better. Later than that, years later, I re-injured my shoulder, and I looked with my ultrasound. When we got an ultrasound, I started using it on my body too, not just my patients, and I have what's called a subscapularis tear, and I have a supraspinatus tear, and I have a tear in my labrum. But guess what? I injected it, all of those things. I have no more pain. I have full range of motion. I'm going to go play golf and lift weights later today, maybe take a run. And I have no pain in that shoulder. But guess what? I still have a subscapularis, supraspinatus, and labral tear. What does that tell you, Timothy? Let me hear from you.
Well, I'm a long-time listener.
Oh, good. So you know my shtick.
That's my purpose for calling.
Okay.
And I would be interested to know what would be the figure for an office visit.
For stuff like that, you got to call the office. Everything is different. So I'm going to give you that phone number. It's 800-300-9300. I'll repeat it for those people that are grabbing their pens and pencils.
Okay.
It's 800-300-9300. And you can call the office right now or after the show. There's people who are picking up phones. And if the phones are busy, just leave your number. They'll call you right back. Do you have any other questions about your left shoulder?
No. That was from a stroke that I had, so the doctor said. And I never had anything done to it. And I guess I was just hoping for it to go away, but it still hangs with me when I reach high. So that was my next question.
Did anybody ever have you get an MRI or an X-ray?
No.
So we know anything? Okay. Now, did you say you had a stroke that caused it? I couldn't quite hear. Your phone is a little raspy.
Yes, I did. I woke up one morning and my head was just whirling around and around in the bed.
Okay.
I couldn't get up.
Okay.
I grabbed the bed, and that dizziness stopped. I turned the bed loose. It went right back, just like a fly buzzing around and around. So I sat there for a few moments, and I grabbed the bed again, and it stopped, and I just held it until it went away. And I haven't been bothered since until I reach high. And if I reach high, like, 2 foot above my head, then I get that pain.
Okay.
You
are able to lift up your left shoulder?
Oh, yes.
Do you have any stroke symptoms now, or did it just go away, just heal?
Not as I know of. I still work a little bit, and I just get tired from standing up and reaching above my head if it has to be. And I sit down and just rest, and everything's okay for half an hour or so.
How old are you, Timothy?
I'm 82 years old.
82 years young.
Okay. I'll accept that.
Yeah, I'd have to check your shoulder, put my hands on it, and see, what the issue is. Mm-hmm. The vertigo thing that you had is, I don't know if that's a stroke or not. I mean, if you were told that's a stroke, that's fine.
Doctor said, and so I didn't bother and just let it go. He said maybe it'll go away, and so that was it.
Yeah, it doesn't sound like a stroke to me, but, I'm not your doctor, so I can't tell you things like that.
Well,
it sounds like you had vertigo, and the vertigo seems to be gone, which is great. Anyway, if you want to come into the office, give us a call at the office number, which is 800-300-9300. And for those of you folks that want to call into the radio show, The number here at the studio, the radio studio, is 866-870-5752. And Timothy, God bless you. I'd love to check out your shoulder, see what's going on, and hopefully get you healed up, okay? You have a great day.
That sounds real good to me because, as I say, I listen to you and I gain confidence in the way you operate because you're an old timer.
Thank you so much, Timothy. We appreciate your call. Again, that number is 866-870-5752, and we're going to William in Sherman Oaks.
Hey, William, Dr. Marc Darrow, how are you?
I'm a little confused, Doctor. I've been listening to you for a couple of years. I came in to see you once. And
how long ago was that, William?
You were in a bad accident. By listening to you, I thought you were next to Superman. And you were limping, and I was a little
I was limping.
And you got mad at me. And I asked you if you could refer me to a nerve doctor, and you said no, but I've heard other people, you referred them to a nerve doctor over the years. I want to know what happened to, you used to use cord blood, and you used to say it was so great, but I haven't heard you mention that. What happened?
Nothing has happened. What did you come in for, William?
I came in because on my legs I was getting a pain, and I have to wake up every hour and a half and put pressure on it, and then it would go away. That's what I came in for.
Okay. And how is that doing now? So we got lost here.
William, call back.
No, it's okay. No. Let me just take this off the air.
Oh, okay.
Because I can handle this one very quickly.
Oh, okay.
So, yeah, William had a neuropathy in his legs, and I don't treat neuropathy. It can be neuropathies. The two main causes are diabetes and alcoholism. And that doesn't mean those are the only two causes, because we also have what's called idiopathic. Idiopathic means that we don't know, as doctors or scientists, what the cause of a disease is. And a lot of people do come in with idiopathic neuropathies where they're not alcoholics, they never were, and they're not diabetic. So it's some other reason. Sometimes it can be like a low B6, low B12, vitamins like that. And that's something that you have to check out with your own doctor. Usually a neurologist is the kind of doctor that I would send someone like William to. And they can get a test called an EMG, a nerve conduction study, that will give us an idea if the neuropathy is something coming from the back or the leg or the arm or the wrist, the elbow, an impingement type of syndrome. So, sorry, William, I can't help you. I'm not the doc for that, and I'm sure I referred you out to somebody, but that's not something I do. I just do the musculoskeletal stuff, which has to do with the joints and ligaments and tendons, and I'm pretty busy all day, every day doing that. So I'm not expanding into becoming a neurologist. So I would say get yourself to a neurologist. There's plenty of them around, and have them figure out what is going on for you.
Okay.
So
I'm
going to go to Claudio.
Okay.
Claudio, are you
Hi,
there?
Dr. Mark.
How are you?
Hi. So I'm a first-time listener.
Okay.
And I felt compelled to call. Can you hear me?
I can't hear you that well, to be honest. I don't know if you're on a speaker or Bluetooth.
Are you driving?
Yes, I am.
Okay. If you could pull off to the side of the road.
What is your opinion on oxygen therapy?
Well, keep breathing. I think it's the best therapy in the world.
I'm 58 and I'm a 4.0
I can't hear you. Claudio, I cannot hear you.
Claudio, you have to pull over
You're going to have to pull over to the side of the
Bluetooth.
road and get off your Bluetooth.
We're not hearing you. Okay. Call us back, 866-870-5752. Okay.
Actually, I'm going to talk about oxygen therapy.
Okay.
There's different forms of oxygen therapy, And one of them that is very popular with, I'll say, wealthy people is getting into an oxygen chamber. And we know some famous actors that have done that, where they sleep in them to keep rejuvenated. And that's one form. It's used also after plastic surgery to help the face heal, or whatever part of the body, or whatever part of the body has been operated on. I've tried it. It didn't work for me because my ears were too sensitive to the pressure change. It's used also for people that have things like fibromyalgia, chronic fatigue. So I'm not against it at all. I think it's a great thing. But it's something you have to go to an oxygen chamber for. There's other oxygen therapy with injections, which is O3. Do you know what O3 is?
No, I've not heard of O3, unless it's got hydrogen.
Yeah, well, you're on the right track for that. Did you ever take any science classes?
Yes, but you don't want to know how long ago that was.
Anyway, O3 can be injected into the body. I actually have a machine at home that does it, and I've tried it for musculoskeletal complaints that I've had. Personally, I didn't find that it worked very well on me, and that doesn't mean it's not going to work on somebody, because there are doctors that do a lot of it. And you can look it up if you like. Just look up O3 injections. And, some people think it's the greatest thing that there ever was. When it hits the body, the oxygen disassociates from the O3 to become O2, which is the oxygen form that we know of. So it's not a bad thing. When I had it done to me, it hurt a lot and it didn't fix anything. So I don't use that in my practice. So that's pretty much it with that on the oxygen. It's kind of a funny story. As my dad got older, into his late 80s, he used to always say when I'd visit him, and I visited him often because he lived in Santa Monica, and he'd say, "Anything I can do for you, son?" And by that age, I was the one doing things for him, but it was so cute the way he'd say, "Anything I can do for you, son?" And I'd say, "Yeah, Dad, keep breathing. Keep that O2 going through your system." And he'd say, "Anything else I can do?" And I'd say, "Just keep breathing. That's all I need you to do." And so we had a great relationship. I love you, Dad, wherever you are right now, flying around somewhere in heaven, I hope.
Maybe he's with my dad.
Yeah, and my mom.
Yeah. You got
Partying.
Well, we still have time for you to call, and our number here at the studio is 866-870-5752. That's 866-870-5752. Lines are open for you. We're here Saturdays at 10 a.m. and again at 1 p.m. And you get a free book when you call today. It's called Stem Cell and Platelet Therapy, Regenerate, Don't Operate. Should we go to Jack?
Jack, you've got a trigger finger. This is Dr. Marc Darrow. How are you?
Yeah, how you doing there?
Living it up. I think you need to turn your radio down. We're getting a little echo from you.
Oh, gee. Well, I have no radio. I'm just talking into my phone, my friend.
Okay.
And
do you have a woman hiding in the corner?
Nobody hiding anywhere. I'm 96 years old. I'm lucky I'm around.
Wow.
You're lucky you're living. Me
That's
too.
Right. I feel that way.
Too.
And you sound so young. I thought you were like 70.
I look younger. Yeah, that's my problem. I look young, but
that's his problem.
But all the girls, they can't believe it. Anyway, you're a busy guy, and I tell you, every time I hear you, I don't have any real big problems, but I like to listen to you because you seem like you know what you're doing, and I like people that are just a little different and approach to medicine. Anyway, I've got a trigger finger,
And I had it a couple of years ago on my left hand, and I went to the doctor here at Cedars, and he gave me a shot, and it was okay. And now I got it on my right hand. And it's, I try to ignore things that are not too desperately bad. And because I'm kind of a guy that believes in, good health foods and good living, like you, exercise and staying healthy and happy and good attitude. So I ignore things, but this is getting to be now. It's been I guess almost a year now that it's bothering me. And
all right, so Jack, you had a trigger finger on one finger, and you went to Cedars to a doctor and had a shot, and it went away, correct?
Yeah, it took a while, but it went away, right.
Okay,
and
here's what I would tell you. Go to that same doctor. He already fixed you one time. Let him fix the other part.
It seems that maybe you got something better. I don't know. I mean...
I personally would go back to the same guy that fixed it the first time.
I could do that, but I don't. For some reason, I thought maybe you have is there anything different that could be done for a trigger finger?
Maybe, yeah. But you did something that worked, and that's what I would do. You know what works.
Yeah, I guess so. Well, okay. I just thought maybe you had a better idea. You might know something a little better than.
I'd stick with what works for you.
Thank
God
you
bless
so much.
Man.
Thank you for your call, Jack. We really
have
appreciate
a wonderful
you.
Day.
Yeah, he sounds so strong for 96. I love that. Okay,
what
David.
do you mean? 96 is the new 30.
Yeah, okay. Got that, boss.
David, Dr. Marc Darrow, how are you today?
I'm doing great. Can you hear me?
Oh, yeah, you're doing good.
Okay, great. I have an interesting question. I don't know if you've heard this one before. I'm interested in your wife's the facelift. And it's because I'm 66 years old, and I weigh about 225 pounds, and I plan to go on a diet. And I plan to lose about 35, maybe 40 pounds. Okay. And I did this about 20 years ago, which was successful. And over the years, the weight creeped back up, and I'm kind of back where I started. And so
it crept up on its own. You didn't help it, did you?
Well, it's my wife's fault because she's a great cook.
But you had nothing to do. You have nothing to do with keeping your mouth closed, do you?
No, it's not my fault. But what I noticed when I did it 20 years ago is as I lost weight and my face got thinner, once I lost all the weight, I actually looked older because the wrinkles got a little bit deeper as I lost the weight. And so I'm wondering if your wife's vampire facelifts might be something that would benefit me.
Yeah, I think it would. I think it'd be great. If you want to give her a call the office, 800-300-9300. She'd be glad to help you out. You can become one of the vampire family.
Well, a couple of things. One is I haven't started the diet yet.
Well, of course you haven't.
So is it something I should, is it something that is after I lose the weight, is that maybe the best time?
The best time for everything on this planet is now. God bless you, my friend.
Yeah, sorry, David, we have to go. We are out of time. And if you're holding, please go to the website, www.lastemcells.com. You've been listening to Living Pain-Free with Dr. Marc Darrow. I'm your host, Nita Valens. Listen to The Pet Show with our pal Warren from 11 to 1 every Saturday, and we'll see you next time.
You've been listening to Living Pain-Free with Dr. Marc Darrow. Now that you've heard Dr. Darrow, you can schedule an appointment to talk with him in person by calling his office anytime at 800-300-9300. That's 800-300-9300. Or go online to lastemcells.com. Again, the website is lastemcells.com. Living Pain-Free with Dr. Marc Darrow is heard every Saturday at 10 a.m. and 1 p.m. here on AM 870 The Answer. Remember, To take the first step toward a pain-free life, schedule an appointment by calling 800-300-9300. That's 800-300-9300. Live long and pain-free. And thanks for joining us today.